Drugs affecting the nervous system with a special look at behavior-modifying drugs. Behavior-modifying drugs overall are drugs that affect the central nervous system, and they correct an imbalance. The goal of behavior-modifying drugs is to create a more adaptive type of behavior. Now, it's important to note going forward, and I'll say it a few times, behavior modification often requires techniques, persistence on the part of the pet owner, and possibly medication to assist with the behavior modification process. So overall, behavior modification drugs are not a cure-all. They're not a silver bullet. They won't fix every animal, but sometimes they can bring the animal just down to a level where they're a little bit more receptive to the owner's perspective and the owner's reprimands. So pet brains, although sometimes we think that dogs and cats just eat, sleep, drink, come to us for a pat, in reality, they have this complex integration of personality, fears, and emotions. And all of that is regulated and governed by the neurotransmitters in their brain. And even the smallest change in a neurotransmitter level in the brain can create huge effects that are identified in the personality and the behavior of the dog and cat. Overall, brains are extremely complex organs, as we know, and they can be altered significantly just by these minor imbalances of neurotransmitters. We've talked about a few of these already as we went on through our lectures. Examples: enhancement of the neurotransmitter GABA creates a tranquilized patient, so an animal that is sedate and feeling pretty good. Examples of that, of course, are through the use of benzodiazepines. If we suppress norepinephrine, then we're going to get sedation, and that, of course, is exemplified by alpha-2 agonists, which, of course, their purpose is to suppress norepinephrine. And then drugs like theobromide, they create hyperactivity because that neurotransmitter is suddenly turned on and creates an excitatory response in the brain. So some of these changes are quite small in general in regard to the amount of neurotransmitters that are changed, but they can create a really large effect on that animal. So the behavior modifying drugs change the concentration of selected neurotransmitters in the brain, and the goal is to decrease or enhance specific neuronal activity. So it's the activity that's associated with those specific neurotransmitters that we have modified. We want to see some results in regard to their specific actions on the behavior. Now, there's a number of mechanisms of action: enhancing the release of neurotransmitters, enhancing the affinity, so that's when the neurotransmitter connects with the receptor and then also has a large impact on that specific neurotransmitter, on its cell. Imitating the natural neurotransmitter and combining with neurotransmitter's receptor to stimulate the receptor. Imitating the natural neurotransmitter and combining with the neurotransmitter's receptor, but producing reduced or no stimulation of the receptor. Prolonging the action of the neurotransmitter by decreasing the breakdown or slowing the rate of termination of the neurotransmitter itself. So we'll look at that one specifically when we talk about select serotonin reuptake inhibitors. And then shortening the action of the neurotransmitter by enhancing its breakdown or termination. Overall, increase or decrease effect of the neurotransmitter is the goal. Of course, we're changing the activity in the brain. So that specific area in the brain that we're affecting that specific neurotransmitter for, that's where we start to see the impact in behavior. A little bit of terminology because it is different than human terminology. Antipsychotic drugs, these are known in veterinary medicine more so as major tranquilizers. We're not technically talking about psychosis the way we are talking about psychosis with humans. We don't have that same theory of mind with animals necessarily. So the drugs we're talking about more so are major tranquilizers, and we might use some of the same drugs to a degree, but typically we're only using major tranquilizer class drugs. Antidepressants, these are more looked at as mood elevating and not necessarily associated with that true depression that humans get. So again, it's similar but different, but we're looking to change the mood and ideally elevate the mood of the dog or the cat. And then anxiolytics, they lyse or break down anxiety. So these are, the goal of this one, of course, is to reduce fear, decrease that fear response. Antipsychotic drugs overall, typically what we're looking at is the phenothiazine class of drugs. Acepromazine and chlorpromazine are the ones that we'll more likely be using in regular vet practice. More potent versions are haloperidol and prochlorperazine, which we don't see too often used in regular practice. It would be a fairly extreme case. The aim of these is to reduce behavioral responses to stimuli. The disadvantage is that they reduce both desirable and undesirable behaviors, because what we're doing, we're not just giving them a reduction in anxiety, but we're actually sedating the heck out of them through the use of a tranquilizer. They're not specific enough in their mode of action as well, so their effects can vary. So looking at phenothiazine tranquilizers, overall they act on the dopamine receptors. This is why in part they can be used as an antiemetic drug, which we talked about previously when we discussed phenothiazine tranquilizers. Dopamine is known to be associated for many emotional-based behaviors, and it's really responsible, or it's really heavily located and flourishes in that limbic system of the brain specifically. So the limbic system of the brain, dopamine, we're talking about emotional-based behaviors. By blocking dopamine, we allow other neurotransmitter effects to show through. So we're kind of suppressing the dopamine so that the other, maybe more positive neurotransmitter effects are able to show through. Unfortunately, the phenothiazine tranquilizers, as we've learned previously, have side effects. There tends to be less interest in their environment. So not only are they, anti-anxiety or fear-free, which would be the ultimate goal, they're sedated and they have this detachment to their environment. So less interest overall in their environment. There are few emotional reactions to stimuli overall, and they have suppression of learned responses. So an instance or an example is where the animal has learned a fearful response, like being scared of a thunderstorm or being scared of fireworks. We can reduce that with these drugs. However, they may also not respond to our reprimands. So if they are a pretty good or a pretty well-trained dog or a cat that listens pretty well, then when they're on phenothiazine tranquilizers, they may not listen as well to our reprimands because, again, they've got that detachment. So these ones were typically are prescribed for thunderstorm anxiety or fireworks. Now, it's important to note, phenothiazines, so they suppress that learned behavior response, but they don't suppress instinctual behaviors, which can be okay, but at the same time can be very bad for some patients. So a good example here, so this is my dog Cinder. Sometimes we call her Cinder Bad Dog. She's Border Collie Cross. And since she was 3 months old, she was a biter, like really severe biter. She had this weird mix-up, I swear it was in her brain, where any kind of emotional stimulation, so if she was happy, if she was stressed, anything like that, she'd whip around and bite whoever was close to her. So we've worked really hard every day to stop her from biting and stopping her from hurting people and chasing. So she's taken a lot of work to suppress those natural instincts, okay? So we knew that taking her on, she'd be, that herding type dog, inclined to bite, inclined to nip. We've worked really hard, and she listens very well to reprimands. So that has been a work in progress, and she's pretty good right now. However, this, of course, is not me, and this is not Cinder. If we were to give acepromazine to Cinder for fireworks anxiety, which of course she has, fireworks phobia, then the concern that I would have is that we could unleash her natural instinctual behavior to bite and herd. So in that case, if she's on a phenothiazine tranquilizer, she won't react to the fireworks, but she might be biting us, or she might be chasing the kid, or chasing the cat, or you know what I mean? So her instinctual behavior could rear its ugly head, which is really challenging if we've worked really hard to get away from that instinctual behavior. The other thing too, we have to have caution with the animals who are selected for these kind of medications. Acepromazine and chlorpromazine both prevent the animals from reacting to stimuli, so that can be good. They don't take away the fear of the stimuli, though, so we have to keep that in mind. A common example for this one is a veterinarian's office visit. If the dog or cat is extremely stressed to go to the vet's office, and we just give them acepromazine or chlorpromazine every time they go to the vet's, then realistically, as the vet's giving them vaccines and poking them and prodding them, they're still extremely scared. there's nothing stopping them from being extremely scared. It's just that we're suppressing their ability to react to that fear. So what a lot of experts in the field recommend is not using phenothiazines for anxious animals or fearful animals, because it won't make the behavior get better. It will just suppress their ability to react to that sort of anxiety and fear during the times when we're sedating them. So keep that in mind. This is, if you have the PowerPoint at home, this is a link that you can look into, and it just has some good use or recommendations about the use of phenothiazine in dogs and cats. So this dog looks nice and relaxed and sedate and calm. In fact, this dog could be extremely stressed out, and we just don't know because they're unable to react to that stimuli. So looking at our chart here, Phenothiazine Tranquilizers, drug names, we've got acepromazine, trade name, Atravet, 10 mg per ml injectable, which we can give IV, sub-Q, or intramuscularly. We can also get compounded oral tablets. Chlorpromazine is, the trade name is Thorazine, and they're known as, or typically dispensed as oral tablets. Mode of action, it's an antagonist, so it's a blocker for many receptors, but it's an alpha-1 receptor blocker and a dopamine receptor blocker as well. Benefits, it can cause profound sedation in small doses, and it can be used to prevent nausea and vomiting. It prevents fearful responses to stimuli. So just remember, it prevents the responses. Side effects, we've got hypotension. It decreases that seizure threshold. If an animal is epileptic or they've seized in the past, then this is a drug we want to generally stay away from, because this drug will reduce their threshold, at which point they can have a seizure. It can add on to the effects of other sedatives or barbiturates, so we have to be cautious, again, mixing this drug with others. In some animals, it can cause that random aggression or hyperactivity. And remembering that it doesn't remove the fear, it lowers the threshold for instinctual behaviors. It's not to be used on fearful or aggressive animals on its own, and they can actually have increased noise sensitivity. So this one, they can have an increased noise sensitivity. Important for us if we have an animal that's heavily sedated. It's a good idea to keep the lights down and keep some cotton in their ears until their sedation has worn off, just to help reduce their sensitivity. So then we have these antidepressant type drugs, and we'll talk about each specific class. We have tricyclic antidepressants, which we'll talk mainly about Clomipramine and Amitriptyline. Selective serotonin reuptake inhibitors, fluoxetine is the main one within that category, and monoamine oxidase inhibitors, generally we speak to Anipryl. So before we start, we're going to focus a little bit on this neurotransmitter called serotonin. And it's a neurotransmitter that plays a significant role in determining mood and behavior. And the right levels of serotonin are often associated with a nice, positive mood, positive, calm mood. Tricyclic antidepressants, amitriptyline is known as Elavale in humans, clomipramine is known as Clomicom in the animal, and anafranil in humans. These ones work by decreasing the reuptake of serotonin, so that's one mode of action. And of course, what that causes the brain to do is it prolongs the action of that nice positive serotonin, so that serotonin neurotransmitter is now floating around in that synaptic space for longer periods of time and having an effect on the surrounding cells. Amitriptyline, and to a degree Clomicom, but amitriptyline also blocks the reuptake of norepinephrine, so we have to be cautious with that as well. Amitriptyline we can use for generalized anxiety disorders and separation anxiety behaviors in dogs and in cats. We can use it to decrease inappropriate spraying or marking in cats, decrease excessive licking or grooming in cats, and decrease feather plucking in birds. So feather plucking in birds can get really quite severe, and typically it's to do with an anxiety, fear, or stress overall. Clomipramine is on the market and approved for veterinary use, so that's a big benefit. It means that it has the studies to back it up. It's often used for obsessive compulsive disorders in dogs. The challenge is, of course, the vet actually identifying whether it's a true OCD type behavior or if it's a learned behavior. Because if we're going to use it for a learned behavior, then it might not have as significant an effect for the animal. We also use it quite often for separation anxiety, and to a degree we can use it in aggression type disorders as well. And just looking here, of course, we've got the dog that spins and spins and spins. That's pretty common with things like OCD. And then this cat that's significantly grooming, so totally barbering their fur, taking all their fur off their stomach and their legs. Again, that can be stress related. So unique features, they don't weaken the response to environmental stimuli the way that the phenothiazine tranquilizers do, but similar to phenothiazines, they will decrease that seizure threshold. We also generally don't combine with SSRIs or MAO inhibitors. And I say that as a general rule, but there are always those special cases where they do need to combine these classes of drugs. So if that's the case, then the doctor has to look into appropriate dosages to ensure that we don't get into Serotonin Syndrome, which we'll talk about in a couple minutes. Side effects, we've got sedation in some animals, constipation, urinary retention is most commonly reported, so all of those three are most commonly reported. Less commonly reported side effects are hyperexcitability, disinhibition of aggression, so where they're no longer inhibiting their aggression, and cardiac arrhythmias, especially in the drugs that have a significant role with the norepinephrine reuptake inhibition. There are also many drug interactions as well as illness interactions. So main interactions, of course, are with other select serotonin reuptake inhibitors or MAO inhibitors. And then also to a lot of endocrine diseases and medical conditions overall, we try to avoid these drugs with those animals. So we've got the class Tricyclic Antidepressants, Amitriptyline, trade name is Elavil, and it's in oral tablets. Transdermal patches may be available, depending where you're located. Clomipramine, trade name is Clomicalm, and they're oral tablets. Mode of action, they have two. A serotonin reuptake inhibitor, inhibit the reuptake of norepinephrine. Positive effects, they enhance positive emotional responses that affect the behavior. They can be a valuable long-term treatment for the behavioral issues noted, and they don't blunt the animal's response to the environment, so they don't get that detached look to them. Side effects, there's many drug interactions. They, of course, decrease the seizure threshold, sedation, urinary retention, and constipation, and then less frequently, hyperexcitability, loss of aggression inhibition, cardiac arrhythmias. They do take at least 7 to 10 days, and some say up to 3 weeks to start to see that full effect. And we have to be cautious with cardiac and endocrine patients. If the animal is susceptible to dry eye, so if they have KCS, or if they're generally just a brachycephalic dog, we just have to be a little bit cautious because these drugs can have an anticholinergic effect, which of course increases the heart rate and reduces secretions. So then that can of course dry up their lacrimal duct secretions and result in dry eye. And likewise in geriatrics, we have to be very cautious if in case small doses could cause like a transient tachycardia, which is not ideal. And then we have the class of drugs called select serotonin reuptake inhibitors. They enhance the effect by blocking the removal of serotonin from the synaptic cleft. So in between the space between the nerves where the neurotransmitters are getting passed from one to the next, we start to see a reduction in the reuptake of serotonin, and it gets to float around in that space for a long period of time and have that sort of action and produce an effect for a longer period of time. SSRIs compared to TCAs, SSRIs are more selective for blocking serotonin without significantly blocking other neurotransmitters. So they don't touch the inhibition or the reuptake of norepinephrine. So we've got human drugs, which we have to a degree brought onto the veterinary side. The main one that we work with is fluoxetine, which is Prozac for people. Fluvoxamine, paroxetine, and sertraline you might see, but most often we're talking about fluoxetine. The uses for SSRIs are similar to that of TCAs. Typically we're seeing them used for obsessive compulsive disorders, anxiety, and aggression. Side effects are a little bit debated. Some say that it is safer to use SSRIs than TCAs because that SSRIs don't prevent the reuptake of norepinephrine, so they tend to have less potential for cardiac side effects than TCAs. A loss of appetite is common, especially initially, so that's something that we need to talk to the owners about. If they're starting their dog or their cat on these medications, then for the first few days, the owner should expect them not to eat as much as normal. In dogs, it can be a little bit more. They'll get the hyperexcitability or irritability or gastrointestinal symptoms. If these sort of side effects occur, then the owner should be calling the vet right away. So overall, we're looking at class select serotonin reuptake inhibitors. Drug names, we have fluoxetine, which is Prozac, fluvoxamine, which is Luvox, Zoloft. Typically, we're looking at an oral tablet form, and this is typically compounded at a compounding pharmacy. In some cases, there might be an availability of a transdermal patch for fluoxetine. The mode of action, it selectively prevents serotonin from being taken up from within that synaptic cleft. So instead, what's happening is it's allowing the serotonin to accumulate in the brain and have an effect in the brain. It enhances positive emotional responses that affect behavior, can be a valuable long-term treatment for behavioral issues noted previously. And the good thing, of course, is that it doesn't blunt the animal's response to the environment. It also does not inhibit the reuptake of norepinephrine, so we tend to get less of that norepinephrine effect on the body, and therefore less cardiac side effects. The main side effects, of course, like all of these behavior-modifying drugs that affect the central nervous system, it has many drug interactions. It does have the potential to decrease that seizure threshold as well. And then again, same as TCAs, sedation, urinary retention, constipation, and then less frequently that hyperexcitability and loss of aggression inhibition. As well as TCAs, it takes 7 to 10 days and up to 3 weeks to see the full effect in the patient. Caution with endocrine and liver patients. Of course, we're getting some of that anticholinergic effect as well, so we have to watch out for dry eye and then the anticholinergic effect in geriatrics. And then we have monoamine oxidase inhibitors, or MAO inhibitors. They increase the effect of dopamine by blocking its reuptake. Phenothiazines, if we look back, they block dopamine and reduce its activity. So MAO inhibitors generally have the opposite effect. They increase the amount of dopamine and enhance the effects overall. Specific behaviors associated with dopamine levels in the brain will be effective. And of course, the main one that we're looking at when we're using MAO inhibitors is cognitive dysfunction in older dogs. So the dogs that we're talking about, they're the old dogs who seem to be losing it. They might be staring at a wall for longer periods of time than normal. They might be barking or whining at nothing. And of course, the doctor has to ensure that some of these symptoms aren't pain-based symptoms. So they're not whining because they're in constant or chronic pain. But once it's determined that it's cognitive or canine cognitive dysfunction, then typically they'll be prescribed Amitriptyline. So Amitriptyline is the trade name. We also use Amitriptyline in Cushing's disease, so we'll talk about that when we discuss our endocrine topic. But mainly here we're talking about its use as a just as a treatment for canine cognitive dysfunction. Side effects, again, it's a behavioral modification drug that affects the central nervous system, so you have to watch out for interactions with other CNS conditions and other CNS drugs. One thing to mention, of course, is Serotonin Syndrome. So Serotonin Syndrome is a potentially life-threatening iatrogenic drug reaction, and of course, iatrogenic means that essentially we caused it. It's caused by excessive serotonin accumulating in the brain. And typically this occurs when multiple serotonergic drugs are administered. So if we think about what serotonin is supposed to do, in proper sort of normal high levels, it can make the animal feel more relaxed, make them feel happy. It's that mood elevating neurotransmitter. Unfortunately, when we have too much serotonin accumulating in the brain, we get the opposite effects. So we get neuromuscular hyperactivity, hyperthermia, autonomic hyperactivity, whereby their reflexes are all over the place, and we get an altered mental state. This often occurs when 2 or more of these drugs are taken without appropriate review, and there are always cases where the doctor might prescribe maybe a TCA and an SSRI for those extreme dogs and cats with behavioral disorders. But of course, when they're doing that, they have to monitor the dosage, and they reduce the dosage of the first drug in order to incorporate a second drug. If the owner goes ahead and tries another drug just because, or they give too much tramadol when the dog's also on an SSRI, then we can start getting into serotonin syndrome. Anxiolytic drugs, we're looking at the class of benzodiazepines, which of course we've talked about previously when it comes to seizure inhibition. So we're looking at diazepam, which is Valium, clonazepam, which is Clomipramine, clorazepate, which is Transine, and lorazepam, which is Ativan, and that should say Ativan, A-T-I-V-A-N. The goal of anxiolytic drugs is to reduce the fear and anxiety, not just cause the sedation. We know that with phenothiazines, we're not reducing a lot of that anxiety and fear, and we're just sedating the patient. So it's kind of the opposite. The action, of course, of benzodiazepines is it increases the stimulation of receptors for the neurotransmitter GABA. GABA itself is inhibitory, so stimulation of GABA is a depressant effect on the central nervous system. The anxiolytic effect that comes with the use of benzodiazepines takes part in a different place of the brain, so it's its own specific center within the brain. In low doses, we would expect to see relaxation and decreased excitability. Moderate doses, decreased anxiety, and of course high doses, we're going to see ataxia and sedation. Have to be honest though, we don't often use these for behavioral modification. They have a little bit less specific activity and they can interfere with the ability to learn behavior modification techniques. So we are reducing the fear, we're reducing anxiety, and we're altering their mental state slightly. So with that, we know that behavioral modification should never be reliant on a drug alone, and it should go hand in hand with a behavioral modification protocol. However, we know that benzodiazepines overall are going to reduce that ability to learn new behavior. So it's kind of counterintuitive. The one that we have seen, or we do use fairly often, if we go back here, is lorazepam. And that's Ativan in people. Lorazepam, I know I've used it on my dog specifically for separation anxiety and firework anxiety previously. We have to be cautious. Benzodiazepines are not ideal for aggression reduction. It depends what's causing the aggression though, so there's a bit of a caveat. If it's a really, really fearful animal and they have fear and anxiety-based aggression, and we can absolutely guarantee that it's fear and anxiety-based aggression, then benzodiazepines might be a decent candidate, or they might be a decent candidate for benzodiazepines. However, if the animal is aggressive and they're dominant, and they'll typically take on anybody, but they are scared or nervous of getting reprimanded by their owner, and if that fear of a reprimand is really what's holding them back from being aggressive, then we don't want to give benzodiazepines to that animal, because now they've lost that fear and that anxiety, so there's nothing inhibiting them from being aggressive. So you have to keep that in mind. Class benzodiazepine is the class, and then a subclass in this case is for anxiolytic properties. Trade names, we have diazepam, which is Valium. That can be given deep IM, IV, rectal, or intranasally. Typically, the IV, rectal, and intranasally we're talking about specifically for reducing the occurrence of seizures. Lorazepam is Ativan, and it's an oral tablet. Clorazepate is Transine, it's an oral tablet, and clonazepam is Clomipramine, and it's an oral tablet as well. Mode of action, it increases stimulation of GABA receptors, and then of course the GABA receptors are inhibitory, so then they're going to reduce the effects of stress and anxiety on the body. Positive effects, as well as reduction of fear and anxiety, it's also seizure inhibition, safe for cardiac and respiratory patients. So this might be a unique one that's used for your cardiac patient or your patient who has seizures. Then we might switch to a benzodiazepine. Side effects, of course, caution with mixing with any other CNS drugs or conditions. In general, benzodiazepines are not recommended for long-term use. We have to watch out in especially moderate and high doses for hepatotoxicity. And of course, in the naturally dominant aggressive animals, it can unveil aggressive behavior. Can't forget as well that benzodiazepines are controlled drugs. There are other drugs as well that can be used as behavior modifiers, but none of them are overly recommended. Beta blockers, antihistamines, anticonvulsants, buspirone, and progestins, if they cause any kind of sedation or relaxation or slowing the heart rate down, things like that, then technically they can be tried, but they're not made for behavioral modification, so they're not ideal in that sense. The other one too, I'll just go back here, that's coming out a little bit more so is trazodone, Trazodone, and it's based on the select serotonin reuptake inhibition properties as well. So trazodone is one that you might see used in clinic, and it has an onset of about 30 minutes to an hour. It's typically given as an oral dose, and it can be used for acute scenarios, so sort of at the time of fear and anxiety, or stress, or it can be given over time as a daily medication. So trazodone is another one that you might see out on the market. Non-drug options, we've got Feliway, which of course replicates the happy feline pheromones. Feliway works as a spray that we can spray onto ourselves, into the cat carrier, into a towel that we're going to wrap a cat with, or it also works as a room diffuser, kind of like the Glide plugins. And you just plug it into the wall, and it takes time. It can take a few weeks to releasing that happy cat pheromone. The other one that I'll show you a picture of in a minute is the Sentry collar, which is a brand name Sentry, and it has the same idea. It replicates feline pheromones. I've had a lot of success with the collars. The sprays are really great for in-clinic use as well. But for me, for my cats that have behavioral issues, we've used them on clinic cats that were urinating outside the box, and I've used it on my own cat that was defecating outside the box. The Sentry collars were really, really helpful. And then we have for dogs Adaptil, and it's the same idea as Feliway. It's a spray, a collar, or a diffuser, and it's just mimicking those happy dog pheromones. So here is that Sentry collar. I really, really liked it. All right, lastly, our role. So behavioral modification is a challenge. There's nothing easy about it. And clients who have those dogs or cats that have separation anxiety or thunderstorm anxiety, firework anxiety, or obsessive compulsive disorder, the owners are normally at their wits' end. They're coming to the vet clinic because they need some help. I've been there. It sucks. It's really, really hard to get through a dog or a cat that has severe behavioral challenges. So our keys here is client education overall. We need to stay in touch with these owners. We need to offer them education, tips, tricks, drug side effects, let them know what to expect. If we don't tell the owner that the dog or cat's going to go off their food for a few days, or that they might be sedated initially, but that will go away, what's going to happen? The owner is going to lose compliance and they'll just stop the drugs because they weren't warned about the side effects. So warn them about the side effects, let them know what to expect, give them tips and tricks, how to pill their cat, how to pill their dog. Be there for support as a resource. So be in touch with them. Make them feel that they're open to call you for advice, questions, to give updates, and then always check in. Follow up on new behavioral tactics that the owner's trying. If you know that they've started a behavioral class, call in, check in on them, see how Fluffy's doing. And then also, of course, call in to check on their drugs, see how the drugs are doing. How's Fluffy doing on the drugs? Is she extremely sedate? Is she adjusting well? Etc. Behavior is not cured with a magic bullet. There's no magic pill that will take care of every behavioral scenario. And it's the central nervous system. So every animal will act differently to each drug. Every animal will have different dosages, etc. So it's very much an individualized plan. The key piece that we have to send clients home with is that behavior is always a work in progress, and consistency and positive reinforcement can go a long way, but the drug will not cure everything. They have to have client compliance. They need to go through training protocols and do their part. It's a really big job. And that is it.